Hi everyone. Please join me for this MAP movement workout. MAP movement means myofascial activated posture. So we're going to be looking at the fascial system and hydrating that fascia through movement and manipulation by hand and by using tools. We're also going to build strength into the body. So today's short-ish session is going to focus on the hip and pelvic area. I'd like you to get ready a foam roller and a spiky ball. If you don't have a spiky ball, a tennis ball will do, otherwise a golf ball rolled up into something soft. And instead of a foam roller, you could use a tightly rolled up towel, large towel. Okay, so the psoas muscle and the iliacus muscle are two hip flexor muscles. That means that they move the leg this way when standing. Important muscle for walking, think of cycling or running. Also an important muscle as a part of this whole core strength cylinder going up through the body. So a weak psoas muscle will give you a lot of trouble. It can also result in tightness in the lower back if it's not functioning properly and gliding properly. So we're going to explore the pelvic area and speak about how everything fit together. My two hands are now symbolizing or imitating the pelvic basin. So I've got one hip bone on the one side, one hip bone on the other side. At the back, there is a flat bone in a kind of a triangular shape called the sacrum. In the front, we've got the pubic bone. And these two basin-shaped bones are called the ilium. And they together hold the body upright and into a strong position where the legs can now function and move. The ilium can rock forward and back, so it can tilt, it can also move sideways, and it's got lots of potential for being strong and secure and carrying the weight of your body. Think of jumping and landing out of a jump or running, sprinting. If we have a tension on the muscles that run through the inside of that basin-shaped bone, it's going to cause us issues. So we're going to explore the inside of our iliac basin by taking our hand to the side of our hip. To allocate the side of your hip, just lean it sideways onto your hand until you feel the sharp bone pressing up against it. And then soften your knees a bit and fold forward as you dig your hand down and inside that bone, palpating the inside of the bone. So palpating just means digging and touching, feeling. Now, for those of you who have tension and tightness through the psoas or the hip flexors, this might be quite painful for you. So take it easy, keep on breathing through your nose, deepening the breath in and completing the breath out. As you rhythmically press your fingers deep into the inside of your hip bone. And breathe in and breathe out. One more time. And I'm using my thumbs and I'm using my fingers. Breathe in and exhale. And slowly come up. So we're going to repeat that on the other side. Find your other hip, side bend, find the top of the bone, then run your fingers down forward. As you flex forward, fold, double, and press into your body. Try and allocate the inside of your hip bone with your fingertips. Pressing, pulsating, and massaging. Now we add the breath. Inhale. Exhale. And inhale. And exhale. Two more. If it's giving you a little bit of referred pain in your SI joint, that's your SI joint on either side. That could also indicate some tightness there. One more time, breathe in and out. And let's stand up tall. Okay, now let's find that very same group of muscle, but lying on our backs. For some of us, this will be a lot easier to find. So we're going to place ourselves down And as we rest on the mat, let's take a moment to breathe in. And exhale to complete your breath out. Exhale completely. And breathe in. Opening the ribs sideways, backwards. And breathe out. Two more. Really feel your ribs going three-dimensionally into all the aspects of your body. Feel the pelvic floor pressing out slightly as you breathe in. Then breathe out with a long, sustained exhale. Feel the ribs closing in and down, the pelvic floor lifting gently, and the abdominals tightening. Now notice a movement that results from this breath. So as we breathe in, there's a slight sense of arching or tilting in the pelvis. As we breathe out, the pelvis rocks the other way and the lower back melts towards the floor. So we're curling the tail and we're rocking the pelvis, these two big bones we spoke about, into a posterior tilt. And breathe in, release. And breathe out and rock. If you can visualize those two basin-like structures on either side of your abdomen, rocking forward, it's going to take your pubic bone lower than the front two hip bones. That's your anterior tilt. And as you rock the other way, the lower back will flatten, so that other triangular bone behind us, the sacrum, that flattens into the floor. The pubic bone is now higher than my two hip bones in front. So remember, the two ilium bones on the side are doing a rotation. They're turning like a dial and turning back. Your spine will move as a result of this turning or tipping. Can you feel how your back arches as you breathe in and the pelvis rocks forward? And how your back gently flattens towards the mat as you exhale. So that's the natural rhythm where we move from breath. And out. Empty your lungs completely. Hold it on the exhale for 2, 3, 4, 5, 6. Release, breathe in. We're going to do that 4 times. Exhale completely. Hold your out breath for 1, 2, 3, 4, 5, 6. Release, breathe in. And exhale, tip. Feel the abdominals tightening even more and more and more. Feel that pelvic floor activating and lifting up, drawing into the body. We're still exhaling, and hold and release. Breathe in. And 1 more. Breathe out. Keep exhaling. Squeeze it. 2, 3, 4, 5, 6, and release. Okay, now that we've warmed up the pelvic area with our breath, pelvic contractions, and the abdominal contractions, we've rocked the pelvis. We're going to use our hands again to explore the inside of that hip bone. So taking your hip in your hands, manipulating it around with your fingertips, and then digging down inside your pelvis. So you're going to go to the inside of the groin area. You're not on the pubic bone, nor are you on that thick tendon on the inside of your leg. It's rather somewhere between the side of your pelvis on the bikini line and your pubic bone on the inside. So it's about, let's say, 2 centimeters in from that bone. And as I press down, because it's angled as a round shape like a wash basin, it's almost as if I'm curling my fingers over the basin and running my hand down the inside of it. And there's the muscle that we're trying to get at. So we're massaging that muscle, rubbing and scrubbing our fingers across the muscle body, finding the tight spots. And it might give you a little bit of a shock even as you come to the tension points. So if you feel that very sore sort of trigger almost, just go gently and work around it. So palpating, massaging using thumbs and fingers. Okay, now walk your fingers across to the other hip and we do the same thing. Do you notice a difference between your two hips? So for me, surprisingly, my right side feels more tender. I was expecting it to be the left side because I'm left dominant. Goes to show, you never can say. And as long as we keep on breathing and keep on moving our bodies and hydrating our fascia, getting into all the little corners of the body, that's just the good thing to do. And last one, breathe in, deeply inhale, and breathe out. And release it. Okay, now that we know where the psoas muscle is, let's find the contraction of the psoas. So I'd like you to take hand to the left hip, cup the left pelvis, push the fingers down, take a breath in to prepare. As you breathe out, bring your lower back to the mat and lift your same knee. So I'm on my left side, I'm going to lift my left knee. Then I'm going to lower the left knee, breathe in, and exhale to lift it up again. Now, as I do this lower and lift motion, I'm going to keep digging my hand down and gently move it towards the crease in the hip so that I can actually feel the muscles and tendons at the very top of the hip where it attaches the thigh bone to the front of the hip bone. Can you feel a body of muscle that feels about as thick as your thumb, maybe even the padding at the top of your thumb? So that's the psoas contracting to lift the thigh. And up and down. Now, if we wanted to strengthen the muscle even more, we would load it. So we would take the sacrum, the lower back, gently bring it down towards the mat to stabilize it. Keeping that one leg bent, we would extend it on a breath out, lengthening it away. So we're using the lever principle and gravity to weigh down that leg, causing stress for the muscle, and then we would bend it back up. And the nice thing about this movement, because it's so simple, is you can really focus on your stability in your back, your breath, and a fluid movement. So we don't want any crunching or twisting in the pelvis. If you're noticing your pelvis rocking towards the side that you're stretching, I want to encourage you to tilt your pelvis backwards a little so that your back is resting more securely on the mat, and instead of lowering the leg quite so far, take it up towards the ceiling at the diagonal. And out. And in, last one. And out. And in. Right, now I'm going to bring my fingers behind my knee, and I'm going to breathe in as I arch my back slightly, rocking my pelvis the opposite way. As I breathe out, I'm going to rock my pelvis towards me, pressing the sacrum and the lower back down. Curl yourself up, pressing your thigh into your hands. This pressure of the thigh into the hands will cause a contraction of the back of the hip. So it's my hamstring and glutes, the opposite set of muscles to my psoas and my iliacus, so the front hip muscles. As I press and contract at the back of the leg, it opens the front of the hip because it releases that muscle. So the hip isn't actually opening, but it is releasing the muscle. I'd like you to pull up and hold it there for 5. Keep on breathing. 3. Resisting with your arms. 2. 1. And then slowly lower down. Now let's do the reverse of that. We're pressing our hands into the front of our thigh. Take a breath in. Exhale. Press your arms away from your body as you press your knee towards you. So I'm pressing my thigh this way and my hands are pushing that way. And now I'm actively contracting that psoas muscle. Notice that the muscle is not changing in its length. So it's staying in one position and just contracting inside that cave, if you like. Hold it for 5 again. Wrap the hands the other way. curl up and press. First exercise, 2, 3, keep the breath going, 4, 5, let's take it to 8, 6, 7, 8, place down the head and press the other way, 1, 2, can you feel your stomach muscles kick in, 3, 4, keep pressing with the arms, 5, 6, 7, lower back on the floor, 8, and up, 1, 2, and we keep that breath going, 3, 4, your thighs shouldn't be moving, 6, 7, 8, and pull, 2, 3, 4, 5, 6, 7, 8, and place it down. Okay, that should feel nice and warm. Let's do the other side. Curling up, pressing away. As you come up into this position, give yourself a little check across the pelvis. Are you straight or have you twisted skew? Align yourself and then curl and squeeze. 2, 3, 4, breathing 5, 6, we'll somehow go straight into 7 and 8, bringing the head down, pressing 1, 2, 3, 4, 5, 6, 7, and 8, curl up and squeeze. 2, 3, 4, 5, 6, 7, 8, and pull. 2, work those abdominals, 3, 4, pull the ribs to the hips, 5, 6, pull that knee in, 7, 8, and pull it away from you, 2, 3, 4, nearly there, 5, 6, deep breath, 7, 8, last one, breathe through your nose, 2, 3, 4, 5, 6, 7, 8, and finish. Let's take the legs to the side, place the soles of the feet together, and let's just give it a little release, bounce it out. Deep breaths in and out, and breathe in and out. And one more in and out. And release it. Okay. So to open and release psoas, we need a combination of stretching and strengthening. Oftentimes, it is the opposition muscles that need strengthening and the psoas itself that needs a bit of stretching and manipulating. So we'll use that combination. This exercise I just showed you is a good strengthener for the psoas, as is that single leg extension one. So the next exercise puts power into the back of the hip sling. We're going to breathe in to slightly tilt the pelvis, as we learned earlier. Breathe out to scoop the pelvis under, posteriorly tilting. But this time we're going to start peeling the spine off. So I squeeze my glutes, I press my feet down, and can you see and feel how the front of the hips are starting to open now as we tuck the tail under and we press the bottom up to the top. You can actually put your hands under your buttocks to give yourself some support and a sense of lifting through the front of the hips. Take a moment there as you inhale. Exhale, then soften your chest, sigh, press the ribs down, roll through the spine, come to the lower back, release your glutes, and we're back down. Inhale, exhale. And we roll up. And once I'm up there and I'm established in that position, feeling quite secure, we're going to do a little bounce. Just a little pulsation. So I'd like you to feel the underside of your buttocks squeezing and lifting. If you can't allocate this and it's going straight into your lower back, that's a real good indication that psoas lengthening and quad lengthening is what you need. All right, so make a mental note. Or if you're shooting into a cramp in your hamstrings immediately, then the next manipulation or loosening or hydrating is going to be for you. Let's do 4 more, 3 more, 2 more, 1 more, and breathe out to roll down. So we'll come back to this exercise and retest that movement. I'd like to curl up, sitting, Take your foam roller, take it in front of you and across the mat. Just get the hair out the way. Okay, we're going to be lying on our front and you're going to place the foam roller across the top of your thigh. So take yourself down onto the roller and then support yourself with your elbows. So in this position, I can drag myself forward and back over the roller. As I roll, I'm going to feel quadriceps muscles, so that's thigh muscles, being massaged by the firmness of the roller. If I keep my toes on the floor, it's giving me some support and I'm not having to push so hard into my quads. If I lift my legs up, there is more weight on the thighs and the manipulation or massage is deeper. Okay, so do what you can, and when you're ready to take it up a notch, you're going to start to bend and stretch your legs, almost like you are kicking in slow motion. Breathe in and breathe out. So the thigh muscles are indirectly linked with psoas and iliacus via their position at the front of the hip. And they are also just connected through the whole fascial system down the front of the body. So as you manipulate and loosen up and strengthen through your quads, you are also going to have to address your hip flexors and vice versa. So we are now creating space in the fascial suit across the front of your thigh to give you more space in the front of your hip, to put it in simple terms. Okay, now I'm going to start with two knees slightly bent, and we call this the windscreen wiper. So just moving the feet from side to side, rolling forward and back, and you will hit your own tender point at some point. And when you get there, I'd like you to just be quite still if you can't tolerate it and focus on that spot. Okay, so I'm going to take you back now. Hike your left leg up. I'm putting my right leg up so I can see the screen better. And you are now lying more on the back hip. So we are now on that area where the psoas muscle crosses the hip. And it's going into the hip flexor muscles or on the front of the thigh. The tensor fascia lata, that's a small muscle that runs all the way down the side of my leg via that long iliotibial band. And as I roll across the front of my groin and my hip, I'm not inside the cave, I'm just on the outside of it, in the crease of the hip. This can be quite tender and quite painful. So I'd like you to go at your own pace and remember to breathe throughout. And out. Now, something I find worth mentioning at this point is that fascial release and hydration can be quite an emotional affair. So I've had clients say that they start crying spontaneously when they do this. It's not always the pain, it's sometimes the emotional release that comes from moving into body parts that haven't been loosened or given attention in a long time. So if you find yourself feeling tearful suddenly, take the time to cry. It's a good cleansing, it's a gift, and don't feel too alarmed about it because it is normal. We're going to come out of this position, and my roller has shifted slightly. I'm going to turn around just because of the screen, and I want to be able to see you. There we go, and we've just got the other leg up, so this thigh is hiked up, and I'm rolling the other hip. And earlier on, I felt the inside of that ilium bone quite tight with this hip, and I'm sort of anticipating that this one's going to feel quite tight as well, but it doesn't. So the body has lots of surprises. There we go. Just breathe deeply and out. And 2 more, breathe in and out. And the last one. And breathe out. Okay. We are now nearing the end of our workout. I'd like you to take your spiky ball. We're going to place the spiky ball on the inside of the hip bone as we had our hands earlier on, but you'll be lying on the ball. So come down to the mat, pop the ball on the inside of the hip bone, and just lie down flat on top of it. Okay, so this can feel quite invasive. It can be quite painful. If you've had abdominal surgery, something like a hysterectomy or a cesarean section, or a hernia repair, or anything where the abdominals have been cut on that line, it's going to have caused some scar tissue on the inside of your body as well as on the skin. And scar tissue is basically fascia that's been disrupted and has grown back together, but not always in a good fluid structure that is elastic. It's oftentimes quite sticky and stiff, like roots going down into your body. So what I'm doing now is I'm just gently swaying my hips from side to side, snuggling up to that ball and gently rocking and applying downward pressure. So as I do this, I breathe deeply and I respect my body, but I also realize that to break down scar tissue and stiff fascia is quite a painful ordeal, and it's not done in one day. So if this is causing you to gasp for air and stop breathing altogether, then take a softer ball, something that gives a little more, and start with that. Maybe even a stiffly rolled up ball of socks. For those who can handle it, come to a complete stop if you like. Relax your legs, close your eyes, and breathe into your abdomen. Inhale into the ball. Envision that you're pushing the ball away with your pelvic floor and your tummy. Exhale as you draw your abdominals in and feel how that ball sinks into the iliac cave. If you press your body closer to the mat, the pressure will be more. Then inhale, push the ball away with your stomach as you expand your belly. Exhale, draw yourself to the mat. Sink into it. Sink, 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 sink. 2 more. Breathe in and out. And 1 more. And out. And relax. Right, we're going to test now. Just take it out and lie down for a moment. And can you feel the wonderful difference between the side that you've breathed into, the ball, and the other side? Can you feel how you've created space there? Your body might feel closer to the floor. It might feel longer on that side. And we don't want to leave you skew, so let's do the other side. The ball in place. Okay, so I can feel this is my tender side. It's complaining a bit. Maybe I want to lie off to the side slightly, or maybe not press into it quite so hard initially. Sometimes we have a sympathetic nervous system response, so that means a fight and flight response to things that cause us pain and that are unfamiliar, as this exercise can be. And then it's a question of breathing very deeply and just mindfully relaxing your body and surrendering yourself to the manipulation. Surrender yourself to the mat and to the ball. Start with slight swaying motions. Respectfully knock on the door of your cave and don't just barge in. And then we're going to try and pulsate a little, wiggle around a little, creating three-dimensional movement. So you've got to swagger yourself a bit. And then we'll settle down into our position, resting heavily on the mat, and then breathe into the ball and out. And breathe in and out, melt into it. One more, breathe in and breathe out. Sink down, 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 and release. Taking the ball out, just sense where you are, sense the openness in the front of the hips and the relaxation through the lower back. And now let's retest the hip roll. Coming up, onto the back. We're going to breathe in, breathe out, tilt the pelvis, press the feet, and lift the hips up. And as you come to the top, hopefully you will feel more space through the front of your hip as you press your hips from under the buttocks, reaching up. And let's do our pulses for 10, 9, 8, 7, 6. Press those arms gently down. 4, 3, 2, 1. And slowly roll back down all the way to the mat. And you can repeat that a couple of times, because now that you've released your psoas, it should feel a lot easier to roll up and down. Thanks for joining me for this workout. See you again next time.